Hello, welcome to the Sports Surgery Clinic online information session on EU Cross Border Waiting List Initiative for all your orthopaedic surgery that you may be on a waiting list for. My name is Fiona Roach. I'm Business Development Manager at Sports Surgery Clinic. We have been working with Northern Ireland now with the NHS, Craigavon and Musgrave Park, plus the cross-border for the last 12 to 13 years. So we have a lot of experience in Northern Ireland and a lot of connections with physios, convalescents and consultants up there. So I'm going to do a small presentation first, and then that will be followed by one of our orthopaedic consultants, Mr. Dan Withers. And following that, we will be doing a question and answer session. So if you'll see a tab there to ask questions, if you type in your questions, myself and the team will answer those afterwards. And also you'll see some other tabs. There'll be a tab for a personal consultation. So if you want to do a Zoom meeting with us, we can talk to you one-on-one, because I know a lot of you will have personal issues you might like to discuss. And then lastly, there'll be another tab which I will need you to press on. That's the contact tab. And that's where we'll get all your details. And then we can send you all your personalized information regarding your individual surgery. So this is the presentation now on the EU Cross Border Directive, and there's a photo of our hospital, just so you can visualize where you would be coming to. Now, so you can see on the map, we're about 10 minutes from Dublin Airport, which means you don't have to go near the city. It's literally just down the M1 of the M50, and also we do have underground parking for you as well. Now, a little bit about the hospital. We're a dedicated centre of orthopaedic excellence. We've been open for 13 years. We do all orthopaedic surgery. So we do hip surgery, which is your hip replacement, and a hip arthroscopy. Knee surgery, so total knee replacement, partial knee replacement, ACL and knee arthroscopy. Shoulder surgery, stabilization, joint replacement, cuff repair, and any other minor shoulder surgeries. Spinal surgery, now we don't do scoliosis surgery on adolescents, but we'll do neck surgery, lower back surgery as well. So things like microdiscectomy, decompression. Upper limb surgery, which is your wrist, your hand and your elbow, and foot and ankle surgery. Now, how to apply for the cross-border funding. Now, we can send you all this information, so don't worry if you don't get to take it down. If the contact tab, if you tap on that and send us your information, we'll send this all to you. So you must be on a waiting list for surgery within the NHS. That's the most important thing. And you will, when you're applying for your funding, need a letter to confirm that you are on the waiting list. Now, you can get this letter from your GP, or the consultant will also have a copy of this letter, but most people, I think, get it from their GP. Now, there are ways, some people won't be on the waiting list, but they have been waiting to get just to see a consultant. So there are ways around this, which we can talk you through, that you can get put on the, you may need to be seen privately here or privately in Northern Ireland. So that's something, if you do have an issue with that, you can, we can talk to you personally on that. So there are the contact details. There's a phone number, an email address. You can actually download the application form. They're based in Belfast, so, and then you send all that information back to Belfast again. It takes about 21 days to get approval, and the full amount is paid about 3 weeks after surgery. So once you have your surgery, you then send them a copy of a receipt that you've paid, and then they will pay you back in about 3 weeks' time. Right, cost, which is always the important part for people. So now all surgeries have different costs. So I would say to you, that's when we will send that to you individually as well. So for example, if you want to come in for a hip replacement, you just contact us, tell us it's a hip replacement you're interested in, and we'll send you all the breakdown of the cost for a hip replacement. So included in that price that we're going to give you is your first appointment, your pre-assessment, which also would include a cardiac echo if you need one, consultation and anaesthetic fees, your surgery, your hospital stay. Also now the new thing is your COVID screen and 2 post-op appointments plus an X-ray. Now, Some people may only need one and some people may need 3 post-operative appointments, but we include those in that price. So what's not included in the price? Any additional consultations with other specialists. So for example, say you had a heart condition or you had a condition with your liver and you either didn't know about it or it's a pre-existing condition. So you may need to get clearance before surgery from a specialist. So that's usually an extra fee. And we do have a cardiologist here, but any other consultations would be outside of the hospital. And you may be able to see your own consultant back in Northern Ireland and just get a letter of clearance. Any additional investigations that are not part of the normal pre-assessment screening, we normally do x-rays and your ECG. So anything outside of that would not be included. Okay, so the actual appointment and your surgery. So like some people, as I said, will have heard of us. They've either know someone that's been here on the cross border or they've been on the waiting list initiative and had surgery here. So if you have a preference for a surgery, we're happy to pass on the details to that office and then they will get back to you. Appointments and surgery can be completed within about 8 to 12 weeks. So you're about 2 to 3 months. Now before it would have been 6 to 8 weeks, but with COVID and also, social distancing, and we have a backlog of work to do since we were closed. This is now probably gone up to 3 months, and it may vary, but that's something that we'll have to see as we go along. As we're able to open up more beds and use more theatre space as well, it may reduce. Now we do try and book all your appointments and your pre-assessment on the same day to avoid any numerous journeys for you. So what I would suggest, if you know that you have maybe a pre-existing heart condition, we'll probably definitely have to do a heart echo. It would be a good idea just to tell the secretary that, so that we're including that on the same day, so you're not having to come back and have that done. You can have your appointments made before you have approval or on receipt of approval, depending on what your preference is. So after surgery. So length of stay obviously depends on what surgery you have. I'm saying at the moment, the knee and the hip replacements, we're saying they're in for 3 days. Now it's 3 days because obviously people don't want to be staying in a hospital environment during this time. So due to the social distancing and people want to get home. So 3 days for a joint replacement. Other surgery, most other surgery is about a 1-night stay, and some spinal would maybe a bit longer. If you did have to stay longer, don't worry, we're not going to send you home. You will be allowed to stay. And in that cost, when we do the prices, some people, they may have to stay a couple of days extra. That price is already covered up to about 8 days. We do take that into consideration. So there are local hotels, which are in walking distance of here, the Crown Plaza and the Holiday Inn. Your relatives could stay there if needed. We do have a corporate rate with them, but I would say to you, just check on bookings.com because you may sometimes get a better rate than we have. It depends how busy they are. Now, things like convalescence or any care required at home, on discharge, you're still entitled to that exactly the same as if you had your surgery done in Northern Ireland. So you just need to let us know beforehand and we can start investigating who your trust is, who the right people are to talk to, and we can get that organised. Now, once we have all those details, that's fine, we have that ready, but they won't actually let us book anything until you are actually in this hospital and you've had your surgery. But just inform somebody beforehand if you need any of those things. You're also entitled to physiotherapy exactly the same as if you had your surgery in Northern Ireland. Now, I would say to you that sometimes you could be waiting a bit longer to get back into the NHS, and if you're having any type of knee surgery, it's very important that you start that within 1 to 2 weeks on going home. So maybe just book some private sessions first of all. And we have a lot of contacts as well with physios in Northern Ireland if you need any more details on that. So frequently asked questions. Now, a lot of people, when they get the application form, wonder what should be included. So I'm just going to give you, the form is actually quite long and looks complicated, but you actually don't need to fill in all of it. The most important thing is You put in your diagnosis, which is for most people, it would be maybe arthritis if it's a hip or a knee replacement. You also put in where you live, you have proof of address, you have proof of bank details, and obviously that letter that says you're on the waiting list. It will ask you lots of questions about prescriptions, etc., which you don't pertain to you. And also a lot of those questions on there are for people who've been on holiday and had surgery and are claiming back money. So don't be put off by the form, and you can ring any of our team, we'll help you answer any of those questions. Because one of the questions they do ask is, where are you having your surgery and what surgeon's doing the surgery? So I would say to you, if you haven't decided and you don't know, it's okay to put down undecided at this time or to be confirmed. The form will still be processed. So another question people ask, what if there are any complications when I'm down in Dublin? Now, if there are any complications that don't pertain to your actual surgery, there's a heart problem, we do have links with 2 of the major hospitals here, and you would be transferred. But saying that, in the whole 12 years, there have hardly been any reason to do that. So just be reassured that it's a very rare occurrence. The other question is, what happens if I need to be readmitted due to a problem with my surgery? If you need to be readmitted within a month's time after surgery, there's no charge. We'd rather you call us, let us know there's a problem, and we'll bring you back into the hospital. So that's the end of the presentation from me, and our teams will be happy to answer any questions. And if you click on that contact information tab, put in your information, what surgery you require, we will send you all that information. You can also ring us or email us. We're happy to take any call. Thank you. Hello, and now the next presentation is going to be by Mr. Dan Withers. He's one of our orthopaedic surgeons, and Dan is a knee specialist, but he's going to talk about all orthopaedic surgery. So just to remind you, if you have any questions, please go on the question tab, and if you need a personal conversation with us, there's the Zoom call tab, and then there's one to download the application form. You'll see that there, and the last tab then is if you have a question regarding any prices, etc., you can request a cost, so please do that. And my colleague Glenda will be with me after Dan's talk, and we will then answer all your questions. Thank you.
Thanks very much, Fiona. My name is Dan Withers. I'm one of the consultant orthopaedic surgeons down in Sports Surgery Clinic, and I specialise in knee surgery. And I was just going to talk through some of the common operations that a lot of the people who come down for the cross-border scheme have performed here. So the Sports Surgery Clinic, for some of you who may not know much about it, it's a dedicated orthopaedic hospital. It was founded in 2007. It expanded quite rapidly, and it covers all aspects of orthopaedic surgery. We recently opened up 2 more theatres, so we've got 7 full running theatres. We've got full radiology services, and also we've got a dedicated sports medicine department, which within it has physiotherapy, strength and conditioning, and also we run a 3D biomechanics lab for a lot of the rehab that we would do with a lot of the athletes. In terms of joint replacement, that's quite a large bulk of what we would deal with, and we would on average do around 1,800 knee and hip replacements a year, with around 1,000 ACLs that we would do a year on some of the athletes. It's quite conveniently located just at the end of the M1, just off the first junction of the M50, right beside the airport, so it's quite convenient. And we have over 30 orthopaedic consultants who specialise in basically all aspects of the skeletal body, with knee specialists, hip, shoulder, elbow, wrist, hand surgeons, plastic surgery, spine, and foot and ankle surgeons as well. Some of the common conditions that we would deal with, I'll just give you a flavour of that. Myself, as stated, I'm a knee surgeon, so some of the common operations that people will be coming down for include some sporting type injuries, And these are kind of the typical twist in knee injury that people may experience. And we would do a lot of arthroscopic surgery. So for someone who has a meniscal tear, this involves a keyhole surgery where you have two small little nicks, and you go in to remove any sort of loose fragment of the meniscal or cartilage tissue that people sometimes would call it, and smooth away the loose fragments. And that's a very common surgery performed here. Anterior cruciate ligament, again, is a very common surgery that I would perform. There's a lot of athletes who would present here with that, and again, it's normally a twist injury to the knee as someone's running at pace and goes to step off the foot. They'll turn and their knee will normally buckle on them, and they'll have an ACL tear. And what that normally involves is taking some tissue from another part of the knee. It can sometimes be one of your hamstring tendons or your part of your patella tendon, and you basically drill two little tunnels, one in the shin bone and one in the thigh bone, and you pass the new graft material up and fix it with various different devices. And the picture on the right there is an arthroscopic picture of a new ACL graft in place there. The other large majority of patients that we would deal with would be people who have osteoarthritis or wear and tear within the knee joint. This in the knee normally presents with chronic pain. It's long-standing pain. People are normally unable to walk very far without getting pain in the knee. They may get swelling at night. Sometimes they have pain at night, and you know they probably need to take medication every day to try and deal with the pain. And what it is, it's a wear and tear process in the knee joint itself. You have this very shiny material on the end of the knee joint, and basically it helps smooth gliding of the hinge joint itself. And with osteoarthritis, you basically get a degeneration of that, and the picture on the right there shows the cartilage worn away and the arthritic process. This is what an X-ray typically looks like. On the right side, you can see that the gap in the knee joint is completely worn away. The knee on the right hand side of the picture has got a nice gap. The other one is completely worn away. And if you present to your doctor initially, you're normally given conservative measures to try and deal with the pain, and that might involve sometimes weight loss, physiotherapy, or exercises to strengthen up some of the muscles around the knee to try and take a little bit of pressure off the knee. Painkiller medication that can sometimes start as simple paracetamol, anti-inflammatories, or else other times you may need some codeine-based medications. And another conservative measure may be steroid injection into the knee. But if all those things fail, then the next and sort of final step that you may consider is a knee replacement. And what the knee replacement involves is essentially shaving away the ends of the bone on the femur and shaving away the end of the bone in the top of the shin bone, and putting metal replacement on either end of that, and then a very strong plastic, which is called polyethylene, in between that, and that's your new knee replacement. On the right hand side there is a picture of what a typical scar might look like after that operation, and this is what a typical X-ray looks like afterwards as well. This is another option. The slide before showed a total knee replacement, and this slide shows a partial knee replacement. This is an alternative if you have a very specific wear and tear pattern and it's only on the inside of the knee. You may be suitable for this. And the advantages of the partial knee replacement are that it's slightly quicker recovery, And also sometimes people would say that it feels more like your normal knee compared to the total knee replacement. This is quite a commonly performed operation here as well, and it does give good results. In terms of the aftercare involved of a total knee replacement, you're normally in hospital around about 3 days, sometimes 4 days. You have crutches for around about 6 weeks, and it really does take a good 6 to 12 months before you're back to feeling some level of normality. And the initial weeks can be quite tough, but it's all about pushing through and doing as much physiotherapy as possible afterwards to get the movement back and strength back in the knee. I think after the operation, physio is absolutely key. With regards to the hip, again, hip osteoarthritis, normally the pain presents in the groin. Again, you may not be able to walk a very significant distance. You might struggle putting on socks and shoes. You get a lot of stiffness, and again, you may have difficulty sleeping at night. And in terms of the options of treatment there, normally you go through the conservative line of management first, and if all those measures fail, you may be considered for a total hip replacement. And a total hip replacement basically involves your hip's a ball and socket joint, and the hip replacement involves removing the ball part of the joint, cutting that away, and placing an implant down the shaft of the femur, and then putting a metal socket in the acetabulum, and then that's essentially your new hip joint is formed. This is what an X-ray might look like afterwards here, and the scar, that's what a typical scar might look like. In terms of the rehab for a total hip replacement, it's normally slightly easier, I would say, than a total knee, the recovery from it. You would stay in hospital for a similar amount of time, and again, you'd have crutches for around about 6 weeks. Shoulder, a very common shoulder operation that's performed here is for rotator cuff tears. Basically, your rotator cuff is a group of 4 muscles which form into one tendon on the top of your shoulder, and those muscles essentially help you lift your arm up. And people who have rotator cuff tears, essentially they're not able to lift their arm up, and they may struggle getting things out of the cupboard or putting their arms above their head. And an operation that's quite commonly performed is whereby there's some stitches put into the tendon, and then the tendon itself is reattached into the bone. That's done normally arthroscopically, and as I said, that's probably one of the most common shoulder operations. Another common shoulder operation would be for what we'd say shoulder impingement. What happens in shoulder impingement is there's a little bursa, which is essentially a small fluid-filled sac which just sits just under the top of your shoulder, between the ball part of your shoulder and the acromion. And sometimes basically that can get very inflamed, and rather than a loss of power, it's more a pain issue whereby whenever you're lifting your arm up, you're getting sharp pain in the arm, and sometimes when you're lying in bed at night, you'll feel pain all the way down the side of the shoulder. And for that operation, essentially, again, it's an arthroscopic procedure whereby they go in and remove the inflamed tissue, and sometimes remove part of the bone as well, which can be a factor in causing the inflammation in the first place. Normally that's a day case surgery, and a very commonly performed procedure. For conditions of the shoulder, for conditions of the shoulder which are due to osteoarthritic change, you may have one of these, there's a total shoulder replacement or a reverse shoulder replacement if your wear and tear is as a result of long-standing problem with the rotator cuff where it wasn't able to be repaired, and your degenerative change was as a result of that. That's when a reverse shoulder is considered. In terms of the spine, one of the most common spinal operations is for spinal decompression for what we would describe as sciatic type pain. So your lumbar or vertebral spine consists of multiple small little bones on top of each other with a gel soft like disc material in between each one. And what commonly happens is that some of the disc material bulges out and presses on the nerves which are coming out each side of your spinal cord, causing pain, maybe radiating down the leg. And an operation involves a small cut in the back and going in and removing that to take the pressure off the nerve. With regards to foot and ankle operations, common operation may be a bunion. With the bunion operation, the common operation would be to essentially break the bone and realign it, and then fix it together with some screws to straighten up your first toe. And the common ankle operation would involve an ankle fusion, and sometimes, if you're suitable, a total ankle replacement is another common operation. And essentially that's just a small flavour of what people would normally come here for to have operated on. And if there's any questions, I'd be happy to answer them for you.
Thank you for listening, and I see a lot of you have been sending in questions, so keep sending in those questions. Now, I'm Fiona, and I'm going to introduce my colleague, who's Glenda Thorne. You can see there. Now, Glenda works with me in finance, so if any financial questions, she'll be happy to take. So now, Dan can't be with us at the moment for questions, but he will be here at 6:30 this evening for the second webinar. If you want to tune in for the questions there, you need to register or email us in any of the questions, and I'll come back to you with any answers that if they're surgically related, and I might be able to answer some of them myself. Right, so we'll start with the first question there.
Okay, so Fiona, Claire has a question there on foot fusion. Is it something we can do if you'd like to help her with it?
Yeah, sure. So Claire, yes, we do that surgery here. We do fusions of the foot. And we have 4 foot surgeons who would do that for you. There's a Mr. O'Flaherty, Mr. Walsh, Paul Moroney, and Gary Caleri. So we would do those, and if you need any information on price, just press that request a price, and Glenda can send you the price for that. But foot surgery tends to be a little more complicated to price because often it's more than one surgery. So Glenda will be able to help you with that one. So the second question I see there is from Daniel. He's currently on the waiting list for 2 years for a full knee replacement. And he's had one on the right knee already. So I think, look, Daniel, that's not a problem. If you want to get in touch with us, we can give you the price again, or you want to talk to us personally about that, just press that, make a personal Zoom call, and Glenda and I are happy to go through that with you. But look, a lot of people will be asking how long. He said he's been on the waiting list for 2 years. How long would we be waiting here? Realistically, at the moment, we're catching up after being closed with COVID. So you're looking at probably for a joint replacement now coming up towards the end of September, towards maybe the end of October, depending on the surgeon.
I just want to jump in there, Fiona. The price for the full knee replacement will be $12,338. That's a package that we give out. So it starts from initial consultation to your surgery, the surgeon's fees, the anaesthetist fees, post-op x-ray, a post-op consultation and a review. It also includes a COVID test. So it's a comprehensive package and it'll include everything.
Yeah, thanks, Glenda. Okay, so now this one is, people are asking, will this service still be accessible when the UK leaves the EU? So as far as we're aware at the moment, they're going to carry on with this until December the 31st. They then, so anyone that applies up to that time and you do have approval, you will be given 9 months to get that surgery done. So that gives you an extension into 2021. And after that, we don't know ourselves. So it may be that they'll extend it if the waiting lists are very long, or they may set up separate contracts with the hospital. But you do have to the end of December, and you do have 9 months once you get that approval. So that might help you there.
Okay, so the cost, what you'll get back for just specifically for a hip and a knee replacement is 6,300 for a hip replacement and 6,500 for a knee replacement, and that's sterling. They will give you a certain amount back for your initial consultation and your post-op consultation for an X-ray, but if you contact the Belfast office, they'll be able to be more specific on that, but you will get a proportion back. It's normally about between 50 and 60%, depending on the procedure, but that's the experience we've been receiving from feedback from our patients, that they normally get about 50 to 60% back.
Okay, lovely, thank you. Now, I'm just going to take a question on the spine here from Declan. You're on the waiting list for lumbar spine for sciatica. So I don't know exactly, Declan, what surgery, but I'd imagine it might be a decompression and a discectomy. Now, a decompression discectomy we do here, and we would probably, you're probably again talking up to around October time to get your surgery done. So I would say though, if you're on the list for a spinal fusion, at the moment we're not doing spinal fusions because you tend to need a lot more aftercare. Now that's not to say that we won't be, but at the moment we're not taking spinal fusions. Or what I am doing is saying to people, if you have a fusion, send me the letter that you have that's put you on the waiting list. I'll ask one of my spinal surgeons to have a look at it and see what he thinks. And if he thinks it's very straightforward, there is a possibility that that could be done. Thank you.
Declan, just to jump in there on your query as well, for the spinal fusion or for the spinal decompression, I can help you out with prices. So hit the hit the pricing tab there and we'll be able to send your price, no problem.
That's right. Actually, Glenda, I just see another question there. Someone did ask for the price on a microdiscectomy.
Microdiscectomy, absolutely no problem. Just again, hit the pricing tab and I'll send that information to you, no problem.
Lovely, thanks for that. Right, so
I'll jump in on this one, Fiona.
Yeah.
So the price that we will give you is in euro, and we don't accept sterling because we don't have a sterling account. So every price will be given in euro. The way it works is payment. We can take payment before admission, on the morning of admission. We have an online portal. You can go on there, put in your card details, and we'll be able to automatically issue you your receipt. You can contact finance department. We'll take payment prior to surgery. You can pay on the morning of admission. We don't accept sterling checks, obviously, because we haven't got a sterling account. But if you have any queries on anything got to do with finance, you can just contact me and I'll show you in the right direction.
Okay. I'm just looking there, Glenda. So someone has asked if weight has an impact on the possibility of accessing knee surgery. Now, what we would say to people is that you'd have to go through pre-assessment, and we take into consideration the risks and look at the weights, but it's not always prohibitive. We have done knee surgery on people because it's catch-22. Often with knee arthritis, you can't move, so it's very difficult to lose weight. So, often if we can get the surgery done, there is more of a possibility of you moving. So it's on individual basis and through pre-assessment, and we would risk assess it. So I'm happy to take a personal call on that if you want to talk to me later on that one.
And actually, if anybody wants to contact us and have a personal call with any of us, that's no problem. You can put a Zoom call in. We'll talk one-to-one.
Yeah, and it doesn't have to be today. We take calls every day, emails every day. So yeah.
Now, just the next question there for both hip replacements. So we do bilateral hip replacements, and if you are on the waiting list for both a left and a knee hip replacement, you will get funding for both, and we actually do that operation here, so you will get funding for both. Obviously, if you want to have them done individually, there'll be separate prices, and again, you will get funding for both once you're on a waiting list. We haven't heard of anybody who has been on the NHS waiting list that hasn't actually got funding. So it does seem to be a straightforward process once you send your application form in.
Yeah, and some people do decide that they want them staged. So they'd have 6 weeks, you apply for funding for that one 6 weeks after that, and you'd apply for funding for that one. Now, there are other people who will have them done on the same day, and there are some surgeons who will do that. Not all the surgeons will, but actually, and saying that, it's a big operation to have them both done on the same day, but people actually do very well afterwards. So it's just, sometimes people will opt for that option because, you know, financially it's a different price. There is a different price for bilateral on the same day, but it doesn't suit everybody.
And if you want the pricing, just hit the pricing tab and we'll get the pricing out to you, no problem.
Yeah. Okay, that's lovely. Okay. It said here, would a referral from your GP be okay? My father has just been referred to the orthopaedics. Okay. No, to actually apply, for us, it would be fine if you gave us a referral from your GP, but to actually get funding, it has to come from a consultant that has put you on that waiting list. So there are ways around that, because I know people are waiting a long time, even just to see a consultant to get put on a waiting list. So you can see somebody privately who could put you on a waiting list, just make sure they have a waiting list, or you could see someone, and that's probably the best way to do it. There is a possibility also that you could see someone down here, and they would send a letter up to Belfast, and they would put you on the waiting list as well. It's a bit of a longer way to do it, but there are ways to do that if your father's been waiting a long time. And sometimes if you want to give Glenda or myself a call on that one, we may be able to give you a bit of direction just to show you maybe the easiest way to do that. And
the next one there, so we don't actually do payment by installments. It is payment in full before surgery. Now, at the moment, we are actually in talks with a financial institution which might allow, which will allow patients to take out a loan against this institution, pay us in full, and then pay them back. But at the moment, we're still just in negotiation talks at the moment. But so at the moment, it's full payment prior to admission or on the market.
I think that person's also asked for a hip replacement, how many days they'd be in. So typical, right, for hip replacement it would be normally up to about 5 days. Since COVID, we're saying 3 days. But obviously, if you had any complications or you just weren't ready to go home in 3 days, they wouldn't send you home without being ready. But we're saying at the moment for all joint replacements, 3 days.
How do you contact the Belfast office? We have a tab for the application form, and there's a Belfast number on the application form. If you contact them, that's straight into their office. Or again, if you need any information on the application form, we can send them to you. But there is a tab down below to access the application form, and all their contact details are there.
I just see a comment there from Carrie. Thanks, Carrie, for that. We have been speaking, and that's nice to hear. So,
hi, Carrie.
How easy it is.
We've been dealing a lot with Carrie.
Yeah. Okay. Okay. How about surgery rehab? Would we go back to the NHS for that? So, yes, you would. Now, so you can, once you've had your surgery here, the consultant will write to your GP then can refer you back for physio and rehab. And what I would say though is some people, it depends where you live. Some people get straight back into physio with the NHS within a week or two. Some people, they're waiting longer. If you're having knee surgery or certain shoulder surgeries, it's important that you start your physio within 2 weeks. So, because it'll be detrimental to the surgery. So if you're waiting longer than 2 weeks, maybe just book 1 or 2 private sessions just to get you through a week or 2 until those appointments come in. But you are entitled to have your physio back again there. So I'm just looking now for the next question. Glenda, do you want to? That we've just answered the physio one there.
The one, yeah.
Yeah, so I'm looking, there's another one coming in here. After spinal microdiscectomy, do I get to go home the same day? Or
normally
is it
a one-night stay.
Due to the virus. Best wishes. Okay, so it's usually microdiscectomy is 1 to 2 days. At the moment, it's actually 1 day. So it's 1 day still. And actually, you're probably in the hospital less time due to COVID rather than more time, because it's probably better to be at home as well. And we are just saying, for any surgery that people are having, we are testing people, swabbing people 48 hours before. You have to have that swab done. And then you isolate as well. So just to remind people, you isolate once you've had your swab for 2 days, just to make sure there's no risk of catching anything in between.
And just to mention there, any prices that we'll be giving you includes that COVID test.
Yeah. So, okay, so can you give me some more information on the hip arthroscopy, stay and price? So a hip arthroscopy, there's 2 consultants that do that here, Tom McCarthy, Professor Mulhall and Johnny Bond. There's 3 actually. Now, we can send you the price for the hip arthroscopy, and it's usually a 1-night stay. Yeah. 1 night for hip arthroscopy, and Glenda can send you on those prices.
Yeah, that's no problem.
Give you an idea there. I have the form filled in and need information about consultant and pricing for the form. Dolores, right, Dolores, if you can get in touch with us and we can give you the name of the consultant, but if you don't know the consultant you want to go with yet, or we're not quite sure what hospital you've decided to go with yet, that's fine. Just write that in and say, look, still in negotiation, or haven't decided where I'm going yet. They still give you the funding. So you can actually apply without having an actual surgeon.
The application form is not based on the actual hospital you're going to.
Yeah. Now, they do like you to have the price, and we can give you the price. So you can put the price in, that's not a problem at all. So I'm just looking here.
So that's
the last question. If anyone's any more questions, put them in there. So situation RE bilateral hip replacement, the pros and cons of one operation and finance situation, and rehab. So rehab is the same. You're entitled to go back to a physio in NHS, and we'd probably push for you to get back in quite quickly for that. You'd have about 2 weeks. Now the pros and cons, I think, probably are very individual to the person. And what I would suggest to you is we can give you all the pricing for both. Go and see just let us know if you want to, you're considering the bilateral. You could go and see the consultants that do them, and then he will go through the pros and cons with you. So he will say, look, yes, you're a good candidate, or you're not a good candidate, maybe we should do one. So you could actually keep an open mind until you see the consultant, and then look, we can always go back and rechange your pricing, or go back to the contact centre and say, look, I've decided now to go for 2 individual surgeries, or I've decided to go for bilateral, and they will just change it accordingly. So it can be decided on the day. Have a chat with your surgeon and decide what's best for you and what he thinks is best for you.
And for pricing, just request pricing and I'll send you on the pricing, no problem.
So that's all the questions. If anyone does want a Zoom call with us, hit on that tab. If you want to download the application form, you can see the tab there for download, or request a price, but also email into the GP line. You have my phone number as well, so call me and we're all happy to help you. And thanks for listening, and I hope you're all well. Thank you.
Thank you.